You're listening to the official OSAP podcast with Michelle Lee, bringing you infection control tips and information to make you a safer practicing clinician. And now, here's your host, Michelle Lee.
Hello, and welcome back to OSAP's podcast. I'm Michelle Lee, and I am thrilled today to have as my guest someone literally around the world from me right now, an OSAP member from Australia, Dr. Rosalind Franklin. Welcome.
Good morning or good evening, Michelle.
Yes. For all of you, it's 6 o'clock Eastern time in my part of the world here in Atlanta, Georgia, and Rosalind's in Western Australia, and it is 7 a.m. The next day. So this is always fun to me to get to chat with you. So thank you. Thanks for joining us. But let me tell you just a little bit about Dr. Franklin and her background. She is the owner of Amalgamate Consulting, and she is a dentist, started out in clinical practice. I'm going to look at my notes here. You were in clinical practice for what, about 10 years? Is that correct?
About 12 years. Yes.
12 years. And then stepped away and went into education and did that for a while, and then realized that she really had this passion for infection prevention education and went out and started this business. And now she is one of the OSAP groupies, I guess you would say, huh? She is a nerd, yes, like the rest of us, all excited to talk about infection control and everything bug related. So we're so thankful to have you as part of the OSAP membership, and I'm thankful for what you're doing in Australia.
Thank you. I'm very excited as well. I've been an OSAP member probably for about 3 years, I think, when I went back to do some postgrad study in infection prevention and control. And I was looking for resources and help, and I came across OSAP. So I went, that looks great. We need one of those here in Australia, and we didn't have one. We don't have one still. So yes, I joined up.
And we're thankful. We have members from all over the world, and so thankful that you found us. So tell our listeners, what is the state of the pandemic right now in your part of Australia?
So I live in the west part of Australia on the coast, about a 2-hour drive south of the capital city, Perth. And Western Australia is about a third of the country, our state. We've been living in this fantastic little bubble where it's almost like what pandemic for quite a while. It's been very, very lucky. But in general, Australia's done remarkably well. We've really got no community transmission. We will have little areas that pop up, and they're from returning travellers who are in hotel quarantine and then something's escaped. But wherever it is, if it's in Melbourne or in, for example, they clamp down really quickly, sort of put everyone into isolation, restricted movement. They changed the dental restrictions, and we've done really well. Very fortunate, I think. We've had a fantastic government, and then all the Australians pretty much have been behind that.
That's wonderful. So are you still wearing masks? Is that a day-to-day part, or is that
no?
No.
Wow, depends where you are in the country. So in Western Australia, a couple of weeks ago, or maybe it was 3, we had one case that got into the community. Perth and the surrounding areas went into a 5-day lockdown. And that included where I lived. Sorry?
For one case?
One, yes.
Wow.
One case. And so for 5 days, It was only go out if it was essential services. Dental practices were mostly closed except for emergency, depending on what level restriction we were on. People had to wear masks. And here in WA, that was a first for us. So once the lockdown was over, the surrounding areas around Perth sort of went back to normal. So we went back to not wearing masks, and people within Perth had to sort of do I think it was 10 to 14 days of mask wearing when they were out, and that's it. We've all gone back to no masks.
So there's hope. There's, for those of, because most of our listeners are here in the US, there is a light at the end of this tunnel.
Oh, yes, there is. And we're very fortunate that we've experienced that fairly quickly. Though it has depended, if you were in the east coast of Australia, Melbourne, other areas, they've had longer lockdowns, harder lockdowns, and have had to wear masks. So it just depended where we were. The community transmission, though, has been practically zero, or very, very few. And we're quite fortunate now. Our vaccine program has just started on Monday. Oh. So we have, our Therapeutic Goods Administration has approved the Pfizer vaccine and the AstraZeneca. Okay. So we're mostly going to be giving the AstraZeneca, but the Pfizer vaccines have been arriving. And on Monday, actually, I think Sunday night, the Prime Minister got it, and a few others. And then Monday, people in the first category who are frontline workers, high risk people, are starting to get the vaccine. I'm in, I think, the third group, because I'm not physically practicing as a dentist. It goes on my age and my health. So I'm in the third group. I think I'll be March, April, and then people further on. Yeah, so there's this huge vaccine immunization program that's now just rolling out. And we're quite fortunate, I think, because other countries haven't had a choice. You've had to, the community transmission, it's uncontrolled, and you've had to basically hit it from all angles. So you've had to employ the vaccination program. We've been able to sit back a little bit, have the time, I guess, check the data that's coming in, but that changes all the time. And yes, slowly roll up, well, not slowly, we're quickly rolling out our program so that we can all return to normal, because people are traveling around the country. But if there's a little hotspot, you get stuck, or you might have to isolate. So, yeah.
Right, exactly. And so for our listeners, we don't always, there's a delay in when we air the podcast. So I just want to let you guys know we're recording, and our date today, what is the date? February 23rd, is February 24th for Rosalind.
For me, yes.
But it's the 23rd. So just to let you know, as we're talking about when things have happened, to give you that perspective, because you never know what can happen before we air this. So I just wanted to share that. So yeah, let's talk about the vaccine. Has there been any, we've had a lot of vaccine hesitancy here, even among dental professionals. What's the word on the street there in Australia? Are you experiencing a lot of that?
I've, I guess, looking at the news, speaking to people in the community, and our Australian Dental Association recently ran a webinar with, people could question about the vaccine, and they had various professionals on there to answer those questions. Yes, I believe there is some vaccine hesitancy here. A lot of people are under the impression it's going to change your DNA, or the process has gone too quickly, I don't trust it. And they're trying to get the word out about that all, yes. And I gathered from the Australian Dental Association questionnaire, I felt there was those who were like, yep, I'm lining up, no problem, here's my arm, off you go. And a few others who are a bit more cautious and might just look at it and decide. And then there was lots of questions, particularly around mandating the vaccine. Do you have to require your staff to have it? And where does that stand in all our legislation? And I'm sure it's exactly the same in the US.
Yes, a lot of same topics.
Yes, very same topics that are happening here. I personally feel very assured by the whole process that the vaccines have gone through, and I'm going to be getting my vaccine. But yes, I do know there are others. So it's a bit very much watch this space. We'll see. We've only just started the rollout.
Right.
and we'll see how it goes. There's also, dentists aren't to like the second tier, I think, of vaccinations, so they're not happening just yet. So there's a bit more time for people to, I guess, hopefully look at the literature, look at the real information, and then make their
and not
decision.
just listen to what or read and believe what they see on social media as well.
Yes, because because people don't have qualifications, you should listen to them. I think there was a satire skit on that recently. And I must admit, when you look at the level of qualifications that the immunologists and the epidemiologists have, and all the people involved in the research, it's phenomenal what they know and what they're involved in. And I don't feel someone who's watched a few things on YouTube can make a informed decision. And that's usually when you defer to the people with the experience.
Right.
But in the end, it is your decision, and you do have to make that decision. Yes.
Well, so let's go back almost a year. I can't believe we're coming up on the anniversary of all of this. And because it was a year ago this week, I attended my last large dental meeting here in the US, the Chicago Midwinter dental meeting. That was the last time we had all, thousands, tens of thousands of people together in dentistry. And not long after that is when we had our shutdown. And so now help me understand, in Australia, I think initially you did shut down dental care in the very beginning. Did you?
Yes, probably around the same time. Do you know what? Yeah, I can't exactly remember the dates. I'd have to go back and look. Everything blurs, doesn't it, after a while?
Well, I think it's the past year for everybody. It's like, what date is it, right? Yeah.
Yes. So basically, I think like dental practices around the world, we're suddenly faced in a situation we've not really encountered before. We had bloodborne disease, cross-transmit, totally solved. It's like, standard precautions. We use transmission occasionally, though dentists had no idea of that word, transmission-based precautions, but we were all over standard. Oh no, we've got something that is respiratory. So I think the Australian Dental Association really stepped up. They had some amazing people working there. They came up with a level of our service restrictions because I think the government, from what I can understand, wanted to shut down like completely, but that's not entirely practical because people are either mid-treatment and then things would get worse, or people will develop toothaches and problems and do need to be seen.
Right.
So the Australian Dental Association, from my understanding, pushed various levels of service restriction. So they came out with 5 levels of restriction, 0 being no restrictions whatsoever, 5 is completely shut down. So they managed to come out with the level restrictions, and then we were introduced to, just like in the US, a whole heap of screening questions that have now come in, pre-screening patients before they come in. Waiting rooms went from those cozy rooms, with toys and magazines, to looking quite open and sterile and chairs spread apart. So you really did feel like you were carrying something infectious. Yes, so those sort of restrictions. So I think we went to a level 4, if I remember correctly, quite quickly. And what that meant was, unless it was essential, you deferred your treatment. If it was essential and you could do a limited range and not generate aerosols, and you could do some hand instruments, or you could do a simple extraction, you could do those. But then there were places set up that you would refer to who could manage these patients in a more appropriate setting. So at this time, like everyone else, suddenly masks were really difficult to get hold of. And so we started having mask shortages as well. And whether that was the surgical masks of the level 2, level 3, or then the next step up where you go to your N95s, P2s and whatnot. So we were having issues with PPE supplies as well. So it all depended on what supplies you had, where the patient was, the usual thing where you then apply your professional judgment, risk manage the situation, and what do you do, So that's sort of what we had for quite a few months. And then in various places in the country, they started to move the restrictions down. So from level 4 to level 3 to level 2, depending where you were in the country. But pretty much, I think across Australia now we're sitting at level 2. That's still not completely normal, but but because we have really no community transmission, everything's sort of back to normal.
Oh, sure.
But if you did have a case where someone was suspected or probable or confirmed, yes, you refer them on to the right. And we have a number of dental clinics either attached to hospitals, or there were some private practices who refurbished their practices to handle COVID positive or COVID suspected patients who needed urgent dental treatment. Okay. Yeah.
So
that's how it worked.
Also, and I think I'm correct on this. So in Australia, you don't have a CDC like we have here in the US. And though CDC does set the guidance, they're not a regulatory agency. We have OSHA that handles those regulations. But how does that work in Australia? How is it set up, your system? Is the Australian Dental Association setting regulations for dental practices,
No.
or is there a regulatory body?
Right. So the Australian Dental Association doesn't set regulations.
Okay.
They can advise, recommend, and that sort of thing. Mm-hmm. Our regulations is set by a National Dental Board of Australia. So all dental practitioners are registered on a national system, and it's run by the Dental Board of Australia. Okay. Now, the Dental Board of Australia then has various policies and guidelines, and one is guidelines on infection control. And then they say what documents or what policies, what we need to follow. So here in Australia at the moment, the Dental Board has mandated that they sort of work with, now it's called the Australian Health Practitioner, the AHPPCC, I can never remember the acronym, but basically this body was advising the government, and the Australian Dental Association worked with them, who then the Dental Board said, yes, that's a great document, this dental restrictions, we are going to say, yes, that's great, thank you for stepping in and giving us a hand. Yes. So that's sort of how that worked for this pandemic. But the Dental Board of Australia does set what documents we follow. So we follow, we have a number of documents. So there's a number of Australian standards. Often they're Australian New Zealand standards, and they're often based on the European standards, based on ISO standards. So we have a couple of standards here for reprocessing instruments that we follow. We have another document we follow put out by the National Health and Medical Research Council. And they recently, last year, put out a whole new document on Australian guidelines, basically for infection prevention and control. And then at the moment, the Australian Dental Association has written its own guidelines on infection control, sort of tailored for the dental practice, very similar to what you have. And the Dental Board at the moment has said, yes, that's a great one, follow that as well. Excuse me. I do know the Dental Board of Australia is currently reviewing and revising its guidelines, and we'll see what then it says, what documents on for.
Yeah, the next stage. Yeah, what happens?
The next stage, yes. And I know, with everything that's gone on, we've suddenly, infection control has suddenly come to the forefront, which has been, it's like we know it all along. It's fantastic, but now we've got people going, oh, that's a good idea.
Yeah, maybe we really should have been screening patients who were sick and not having to come in for their appointments.
Exactly, and normally, you go to work a bit sick, and I understand that, because as a dentist, you've got a full day and you've got a cold, you tend to just mutter through. You might pop cotton rolls up your nostrils and put on a mask, and drip and then change it, but you'll often, and you'll be as good as you can with your infection control not to, pass on your cold. But that's one positive thing, is I think that we don't have to go to work sick. It's okay to stay home. And I like the fact that we tend to get complacent, and it's just human nature, isn't it, about infection control? And suddenly it's like, oh, Washing hands is actually a good idea. Yeah, I never thought I'd hear politicians talk about washing hands and hand hygiene. And then the word epidemiologist becoming everyday language.
Right. Yes. Well, I mean,
Yes.
and I just remember hearing hearing press conferences in the spring, and they kept referring to PPE, and I thought the whole world knows what PPE stands for now.
Yes, we do now.
Right.
Yes.
So,
yeah, and so in that sense, it's been fantastic. It'll be interesting to see where we go from here in infection prevention and control in dentistry, where it's suddenly brought to the forefront. And I think in the States, in the UK, you're probably a bit more on top of extra oral suction, now looking at ventilation and air changes. And so it's going to bring in a whole new raft of things. And I know things have been flooding the market.
yes.
And, what PPE do we wear? How do I stay safe? How does my patient stay safe? Yes. But look, there is light at the end of the tunnel, and I'd like to think us New Zealand's doing fantastically well as well. So yes, you can get back to more normal dentistry, but it might have a few more little extra infection control components to it now than we used to, because we've got a respiratory disease now. Right.
Well, Rosalind, I also, I just want to talk to you about this other little project you have going on. That is just, it's something that I am dealing with all the time as OSAP puts out new messaging and webinars, and it's finding dental stock photography that is correct. And it, so many people, you open up a dental trade magazine, almost I will say every single time I can open up a dental trade magazine and find some image in there that's not correct. And you have identified this as a problem, and you are trying to build a business and get some stock photography that's correct. Is that right?
Yes, I am. I'm very excited about this new venture. Yes, like you, over the past 5 years, as I've been running Amalgamate, if I go into a dental practice and I do some training, you put together your PowerPoint, and it was hard. I could find what not to do photos, what's incorrect PPE, what's incorrect procedures, but then I didn't have photos to say, this is correct. Yes, as you very well know, those generic dental stock photos show glamour models, masks under chins, the models holding dental instruments in ways you'd never hold them. And why would you put your instruments in your pocket of your lab coat? And and I think there's a call for some of those glamour shots with happy smiles and happy people, but there's no real photos. And I feel when you go onto a practice's website, you want to see actually real photos. You don't want to necessarily see the horrible, unhappy, but you want to see real photos and go, oh, look, they do care. They are empathetic. Yes. And so I thought, right, maybe I should take some photos and sell them to one of the big stock photo companies. And I had a chat with I've got a photographer, and she and I have been working together. She took some headshots for me and some shots, and she's not afraid of dental. She had a mum who is a dental prosthesis, so she's not at all, queasy about going into dental practices and taking photos. And she said, look, why don't you just set up your own e-commerce website? And I went, okay, let's do this. I've got the time now. My children are grown up. I can devote my time to this, and off we went. And Dental Stock Photos was born in November. So we started with, I've got 1,000+ images there. I'm very fortunate that I have some dental colleagues here who are willing to open up their practices and let me come in and photograph, either candid or set up, and patients who were happy to sign the release forms and let me photograph them. So I managed to go into an orthodontic practice, just then 2 general dental practices. And just this past week, I did another 12-hour marathon photo shoot at a practice in Perth. And we got some more candid photos. And they have a cavoodle named Benji, who's their dental therapy dog. He's in training.
Oh,
And he's in the reception waiting room. So patients, if they're okay with dogs, they check all this before he comes out. He can come out on his lead and he stays on the ground and you can pet him. And he was just adorable. He's apricot teddy bear that's gentle. So that was fantastic. Yes, and the Australian Dental Association has actually asked me to take their specific imagery for their upcoming infection control guidelines. So I've got them on board, which is fantastic. And I've just got so many ideas. But the photographs we took, because we're at level 2 restrictions, we're in surgical masks, safety glasses or visors, not necessarily, we don't tend to wear long sleeve gowns unless we're in transmission-based precautions. We advocate bare below the elbow.
Different than the US. Yes, because we don't have any skin showing ever.
Yes. Yes, well, the Australian NHMRC guidelines is bare below the elbow for sort of your average everything. But if we moved into transmission-based precautions, or if you're doing surgicals and you're moving into a surgical aseptic field and all that, yes, you wear your surgical gowns, but we're bare below the elbows. Yeah, that's how we roll here. Yeah, so a lot of my imagery is sort of around our Australian standards at the moment, and that's what I photographed a lot of. But then my next photo shoot, I want to get more into perhaps what you would see in America, because I have the luxury where I can go in and set things up and hopefully stage it so that you've got some photos and they're accurate.
Yes.
That's where I'm heading. But gee, there's so many photos I could take. I'm hoping one of my pediatric dentists will open up. My friend at the endodontist will open up. I'm like, oh, I can go to town.
I can tell you, I mean, it takes hours to find the right image sometimes. I know my our marketing coordinator for OSAP is listening in on this call right now, and she's in the background, Stephanie, doing all of our technical support for us right now, and she knows how difficult it is. And we have to just be such an eagle eye to, sometimes say, oh, that's not going to work. And now with the pandemic, we're even still even more attentive to it. It's just really challenging. So, but I just love that. I wish you so much success with that project, and I'll be cheering for you because I know we all need to find some good images. But thank you. Thank you for joining us today. I just thought it would be great to have a perspective for our listeners from another part of the world. And after speaking with you the other week, I thought, oh, it's going to bring us some hope as well to hear that other countries are getting through this. So thank you.
Yes, and I really hope so. My one of my best friends lives in North Carolina, and we Zoom regularly, and she's tired and of it all. And it's hard for me to say. She says, what are you up to today? Oh, well, I'm driving up to Perth to see the family, and then we're going here, and then we might go to the movies. Like, sorry.
I know. I haven't been to a movie theater in over a year. Simple things.
I'm so fortunate to live here. I'm very proud to live here. And yes, let's hope. Yes, now that the vaccines are rolling out, things are starting to happen. Yes, it'll still be a period of time, I think, before international travel happens again and people move around. But yes, it'll be so nice when that a bit more of a normality comes back to everyone.
Yes. Well, thank you again. And thank all of you for tuning in today. And if you're not a member of OSAP, please check us out, osap.org. You can find all of our membership benefits listed there. And stay tuned, because we're going to be rolling out registration for our virtual annual conference that will be held June 2nd through the 5th. And it will also be recorded. So no matter where you are around the world, if you can't participate live, you'll be able to listen to the recording. So we hope everyone will consider joining us for our annual conference as well. But until next time, everyone, please stay safe, and we'll see you soon. Thanks.